Welcome to NU 623 Adult Healthcare Unit 6 Presentation 4 on Obesity. Please read the corresponding chapter in your book so that you understand the full amount of the information, as only the highlights are given here in this presentation, and utilize any resources in your course module that can help you prepare for this information. In obesity, subjective information could be fatigue, decreased energy or weakness. They may have joint pain or be shortness of breath, probably have activity intolerance as well. They could be very sleepy during the day or suffer from depression. They may have had previous attempts at weight loss or have a family history of obesity or eating disorders. Objectively, it's pretty straightforward. You have to have a BMI of greater than or equal to 30, a waist circumference greater than 40 inches in men and greater than 35 in women, or a waist to hip ratio of greater than 1 in males and 0.8 in females. See page 939, table 59.1 for the diagnostic classifications of obesity. The ICD codes should correspond to these when you're doing your visits, and there's different codes for different levels of BMI. For your differential diagnoses, weight gain can be either from an exogenous or an endogenous factor. So you could be looking at a hypothyroidism, a Cushing syndrome, or a hypothalamic injury, in addition to obesity due to lifestyle and eating patterns as well. Diagnostic tests are not necessarily needed in order to diagnose obesity. It's a clinical diagnosis. It's very straightforward, but your tests will help to rule out any underlying causes or risk factors that can be associated with diabetes. So what you would want to do is at least a thyroid stimulating hormone to rule out hypothyroidism, a CBC to rule out anemia, because some of the symptomology can lead towards the possibility of anemia, such as the shortness of breath or the fatigue or the weakness. A CMP can be done, which will also grab several things that are mentioned in your text, including aminotransferases, which is your liver function test. They could be elevated with fatty liver, which is quite often seen in obesity. Alkaline phosphatase is related to liver, gallbladder, and bone, and the bilirubin is generally going to point towards liver as well. The CMP also has electrolytes, and it will also give your creatinine and BUN, which is your markers of renal function. Your A1C should be done because of the high propensity of diabetes with obesity, and then your lipid panel should be done to assess for hyperlipidemia. A urine could be done, and consider this if you have a strong suspicion of type 2 diabetes, because you're going to want to be checking for spilling of urine or spilling of glucose into the urine, or if you are thinking about any other metabolic syndromes. An EKG should be done, especially because coronary artery disease is tied towards obesity as well. And if the patient has signs of metabolic syndrome such as hypertension or hyperlipidemia or insulin resistance, then you're looking probably more towards a diabetes type of an issue. Your book discusses a few extra tests that may be considered, but those on the screen are the most common ones according to current practice guidelines. The goal of treatment is mainly to reduce visceral obesity and comorbidities and decrease the risks for other comorbid conditions. Secondary causes need to be treated, so you need to find out what the underlying cause is and then treat that, such as, for example, a hypothyroidism. A multidisciplinary approach is best to use for weight loss because it can be it's a chronic thing, and it requires a lot of help from a lot of different areas, including maintaining a special diet, encouraging and supporting exercise, and then cognitive therapy may be needed to help with motivation and also depression. See page 943 for details in your book. There are several medications that can be used that are available for helping with weight loss. On page 944, you can take a look at those. Some medications that are used are actually controlled substances, and they may have significant side effect profiles such as cardiac involvement. So be sure to review these medications and understand the pros and cons of each. If medical management fails, you can look to a surgical procedure. To qualify for a surgical procedure, you have to have a BMI of greater than 40 or a BMI of greater than 35 and also have comorbid conditions. Several procedures are available surgically, and you can view them and the complications on page 944. When a patient is referred for surgery, they typically have to undergo months of controlled dieting and behavior intervention prior to being cleared for the surgery procedure, because things such as a gastric bypass are very life-altering types of surgeries. Close follow-up is going to be important. Those that are followed closely are more successful in weight loss, and sometimes these follow-up visits need to be weekly until these healthy habits have been formed. You're going to want to follow if you're doing medication management. You want to keep doing goal setting and reevaluating of goals, and making new goals, moving along in a stepwise fashion so things aren't too overwhelming at first and they're gradually getting where they need to be. Emotional support is very important too. Referrals can be made to endocrinology if there are factors that involve inheritable diseases causing obesity or reversible etiologies. Bariatric surgeons can be consulted if they meet the criteria for BMI. Weight loss programs can be utilized, but they can be very expensive, so support groups are usually a better option for patients. A nutritionist is a great place to start because they could teach them proper management of their diet, including portion control and caloric intake. Behavior therapists are necessary when a patient is suffering from depression, from obesity, or if they're having trouble being motivated to stay on task to try to lose the weight. There are other referrals that can be made based on the comorbid conditions, such as if there is a heart involvement, you would have cardiology on board with that as well. Please read your chapter and also take a look at any links that might be available in the course module.